Where's my timer? Good afternoon. My name is Jose Roberto Sevas Perez. I go by Robert usually. And for this presentation, I'm going to be talking about the knee jerk reflex. And so, we just have a short presentation. So, what exactly is the knee jerk patellar reflex? It is a very popular test. A lot of kids see it, and a lot of kids do it on each other. They'll grab any type of instrument and hit themselves on the knee. They don't really know what they're aiming for. They're just hitting it and tossing their leg to see if they're doing the reaction correctly. Um, but what we know it as within our class is that it is a monosynaptic reflex, and it what that means is that it's only utilizing a motor and sensory neuron, and there is not an interneuron in play here. And with this method, with the knee jerk reflex, we're using it to check for nervous function, proper nervous function, and make sure that nothing is astray within that system. And so, how it is done is that the patient will be seated with their feet elevated off the floor. That does not mean that they're raising their feet up. They're going to be sitting. Their feet are going to be relaxed over an edge, and we just make sure their feet are not touching the floor. And after we have this position, we're going to use a reflex hammer. And within the diagram here, you can see the exact location, but you want to hit the patellar tendon. Not too hard, but also not too soft. Once you hit it, you want to observe the reaction by the patient. And under normal circumstances, the leg should kick slightly forward. It should come out a little bit, and um, yeah, the mechanism at play here, as you can see here, has a short description real quick, but long story short, um, when you strike the patellar tendon with the hammer, you're stretching the muscle spindles in the quadricep muscle here. And so what that does is that it sends a signal due to this reaction through the sensory neuron into the spinal cord. And from there, because it is monosynaptic, there is no interneuron in between the sensory neuron and the motor neuron, and thus the signal gets sent straight to the motor neuron in the spinal cord. The location is uh, in the L2 and L4 segment of the spinal cord. So it's in the lumbar region, the lower back. Um, yeah, and so from there, an alpha motor neuron creates an efferent pulse to the quadricep femoris muscle. And what that does is it contracts the muscle. And whenever the quadricep muscle contracts, you see the leg get kicked forward. As you see here, yep, the muscle contracts and it causes the leg to kick forward. And that's what we observe. It should not be that insane of a kick, but it should also not move at all. And you see a little bit of movement forward from the leg. A little side note on top of that is that there's also an inhibitory interneuron that is in play here that is outside of this mechanism. And so what it does is used to inhibit the hamstring muscle. The picture does not show it, but the hamstring is going to be just on the bottom here. So it's posterior to the leg, posterior to the quadricep muscle, and it is known as an antagonistic muscle to the quadricep. So what that means is that instead of if the hamstring were to contract, then the leg would be pulled inward. But in order to inhibit that, you have the interneuron inhibiting that movement and that the activation of your hamstring. And all that means is it just allows for the quadriceps to kick forward more. As we mentioned above as well, there's also um, sorry, the clinical reason we use this is for nervous system function to check how the nervous system is doing, specifically within that region. So within the lumbar region, you could check to see how well we're doing there. And yeah, so that is the basics of the knee jerk reflex.